Hi everyone, hope you had a good weekend. It's Sunday night, and for some, Mondays are dreadful. The video I kind of decided to go ahead and do this video today last minute because tomorrow is the 1st of August, which is the start of Gastroparesis Awareness Month, and I'm hoping to do some more videos based on that. Um, I did have a nurse comment on one of my videos. Um, I don't know whether or not it was a newer nurse or just a nurse who hadn't experienced a lot of the common problems there are that come with some of these diseases like dysautonomia and gastroparesis. But he had asked, in what way can nurses make it better for us? He stated that the patient that he was talking about had dysautonomia and knew that the medication the doctor wanted to give her would cause problems. In regards to the fact that she had dysautonomia, it would her body wouldn't react properly, and the doctor just refused to listen. So the patient had to deny the medication, and I guess eventually another medication was written. In the medical field, especially in the emergency room, they say when you hear hooves, think horses. Think of um, the most obvious diagnosis. Your heart hurts. It's hard to breathe. It could be heart related. You have hives. It's um, an allergic reaction. You are throwing up. It could just be the stomach flu. Could be, they're not going to go to gastroparesis. They're not going to go straight to your autonomic nervous system not functioning properly. Things like that. Um, I've been very lucky in the time period where we have required the emergency room and elongated hospital stays to have some really amazing nurses on my side. Um, I've had a few bad ones, and I'm not the type of person that's going to take it out on them. But it's not as easy going with between the conversation between us if you're not the best nurse. Luckily, I know a lot of nurses in regards to friends and family, and they're all amazing. Even from a distance, they do what they can to help. Um, so because in the ER, especially, um, it's more of figure it out as fast as possible and get that patient taken care of. Hopefully, that means, you know, fluids, medication, they can go home. Um, a lot of doctors just don't want to hear anything additional. And on top of that, a lot of doctors don't believe that patients are as educated or knowledgeable about their medical condition as the doctor is. Um, as a nurse, it's your responsibility to make sure that what the patient is saying is actually what the doctor is hearing. Because sometimes the doctors will listen and I can say I'm in pain and Motrin, I'm allergic to Motrin, and all of a sudden I'm drug seeking, asking for Dilaudid or, morphine, and it has to be 10 milligrams. Like, it's not. Unfortunately, there's certain boxes that patients get placed into when in the emergency room. So, as a nurse, it really is your responsibility to listen to the patient. And sometimes the patients can't vocalize what they're trying to say as much. So, when I say listen to the patient, I mean truly listen to the patient. We know you have 4 or 5 other patients. We know their buzzer might be going off, but at the same time, if I'm not feeling good, I may not be able to think of the word that I need to tell you. Think of the medication that I know will make me sick. Things like that. Um, Even on a normal day like today, you know, I stop and say and I have to sit there and think about what I just said. So you gotta remember the patient is in pain, possibly already medicated with some type of medication that could, you know, make them sedated. Um, like I have to explain to a lot of doctors that um, medications don't make me drowsy anymore. Like fentanyl and Versed, they don't work for me for surgeries, and they don't want to believe me. And when I get pissed off and I start crying, it's the nurse that comes in, listens to what I have to say, and make sure the doctor understands that I'm adamant that it's not happening if I'm not under anesthesia. Um, I've become, throughout my hospital stays, I would consider most of the nurses my friends, not, one of my caretakers. Um, I'm I'm a really easy patient. I only call them when it's time for my medication or if my pump needs a new bag of saline. Other than that, I tend to do, it's not the right thing to do, but I tend to do everything by myself, including connecting and disconnecting from my pump, which you should not do. But, you know, they understand. They've always been very understanding of any frustration I might have, or if, um, you know, if I'm having problems breathing, or if I feel something is wrong. One time I had an allergic reaction to something. My lips were swelling, my eye was swelling, I was having trouble breathing. The doctor did not want to give me IV Benadryl, um, and they wanted to first try IV, I'm blanking now. First they wanted to try an IV steroid, and the nurse was by my side holding my hand, and every couple minutes or so she'd walk out and she'd go and talk to the doctor and say, hey, this is what's going on. She's still not breathing properly, she still has all this swelling, she's having an allergic reaction to something, and she has this history of allergic reactions. I will never forget that nurse. um, she was she fought for me like no other, and she had just met me 2 hours before her shift start, when her shift had started. Um, and so really the best thing to do is just to listen to your patient and be patient with them, because when you're not feeling well, you're not your entire body, your brain isn't working, your brain to your mouth is not functioning proper, the signals are not sending for you to say the words, um and then when something happens between the patient and the doctor, the frustration levels can, you know, just frustrate is not even the right word. Um, it it is quite honestly, um, the nurses that make the hospital stays, the ER visits, any admissions, pre-surgery, post-surgery, um, testing. It's you guys that, you know, make it or break it. Um, and I just want to thank everyone who's, put themselves in that situation. I was on my way to nursing school. It's not easy. And then from the patient side, I've been there, done that, obviously, and it's not easy dealing with a patient who's sitting there crying in pain and can't even talk to you. But y'all are the superheroes, and as long as you're there and, come in with a smile and come in and say, "Are you feeling any better?" Show the concern, whether you may never see this person again, so the concern may not actually be there, but just, you know, showing a little bit of concern, faking it, um, it means a lot. Having been on that side and having, my friends and family who are in the nursing field and having been yelled at by patients, working at doctors' offices, doing different things, and getting cussed at. I know how frustrating working in the medical field can be. But quite honestly, for those of you who are new to nursing, um, stick in there. Just with experience, you'll learn that you guys really do make the stay. Um, I remember my stays by the nurses. Like, yeah, I've had great doctors. I've had amazing doctors. But it's those nurses that come in and make me laugh when I'm in, when I can barely move from pain. It's those nurses who come in and look at my blanket and say, "Duke, oh, I like Duke." And it turns out, that nurse has the same name as one of my best friends, and her son is my nephew's name, and all of a sudden, I feel like my two best friends are with me in the hospital. Just be relatable. Even if they call you 1,000 times, you know, talk to the doctor. You're that in between person. You're the one that makes sure that the right information is getting to the doctor or to the patient. Because between the two, there's miscommunications thousands of times. Um, Again, thank you to all my nursing friends and family and all those who are nurses. You don't understand how much you are appreciated. Um, I had a home care nurse for almost 3 years for my central lines, and she showed me the epitome of, um, if you love your job, you will never work a day in your life. And I wish I could get to that point, and hopefully one day I will. And yeah, that's about it. I mean, it's really not, we don't expect a lot as a patient, um, in regards to nurses. Sometimes it can feel like you're expecting too much. Um, but really, if you just, when the patient comes in and you start off on the right foot with the patient, it'll help. Like, come in with a smile, introduce yourself, ask what's going on, find something to relate to, and that really will help. Um, the connection between you and your patient, which will help in regards to the patient's care from the doctor. So I'm really hoping that I didn't just repeat myself 1,000 times for the past 13 minutes. Um, and that something was brought out from this video, because the fact that actually somebody would even ask that, like, blew me away. And it I could tell that the person asking cared about his job and cared about his patients. So, um, it wasn't something I was expecting on doing right away. Well, I'm not doing it right away. It's been a few days, but it wasn't something I was expecting to do tonight. But tomorrow starts off, Gastroparesis Awareness Month, and I kind of want to start getting my focus on that for the month. Hopefully get a few new videos up and do what I can, um, that way really quickly. Um, with my gastroparesis, I no longer I don't tolerate tube feeds, so I was on TPN for almost a year, and you can kind of see the scars from all my Hickmans. But I got a really bad infection, and from that infection, we decided to discontinue TPN completely, um, because of the risk of that infection reoccurring at the time. I have yet to restart, but I get IV fluids daily, um, to help maintain. So, uh, to help maintain my hydration, especially on days as my mom and I were talking about this week. Um, I believe I had one full meal 4 days this week, possibly, maybe less. Um, Early today and yesterday, I've had the most to eat. Um, so hopefully I can get in some new videos in regards to that. Um, as this video is, I'm always up for questions and suggestions. Um, and then also through Vials of Love, these should be up to sell soon, hopefully. In child and adult sizes. It's a t-shirt that says, I eat through my heart. What's your superpower? And it says Team TPN on the back. Well, it's a hashtag. And also, what does sick look like? It's for Invisible Illness Awareness. This is obviously a kid size. And those will be up soon. Hopefully, by the end of the week. Once I'm sure about the amount of shirts that I have. And that's it. Thank you.